Hi, this is your pharmacist, and today I will talk about the topic of ulcers. What are the type of ulcers? And it is the most common GI tract disorder. We have ulcers in our mouth, and we also have ulcers in our stomach. So ulcers can happen on your food, on your body, inside your body, and in your mouth as well. So how we can define an ulcer? It is an open sore in the stomach lining. When we have an ulcer in our mouth, we treat it with some OTC medications. There is a ruptured lining in your mouth, and there is a yellow patch. So when the smooth surface of your skin gets ruptured, there happens an ulcer. So what are the types of ulcer? There's a duodenal ulcer, esophageal ulcer, and gastric ulcer. So you can see the stomach ulcer is in the lining of the GI tract. It is inside the stomach, and the lining of the stomach is worn, is eaten, is ruptured, is now not smooth. So let's discuss how it happens. How ulcers occur. When the protective lining of the GI tract is worn away and bleeding occurs. So first we have to keep in mind that there is a protective lining that is inside the GI tract, and when it is worn away, it is ruptured, then bleeding occurs. And ulcers are sores. They are patches of dead tissue along the walls of GI tract. So it is the protective lining of the GI tract. When it is worn away and bleeding occurs, we call it an ulcer has occurred. They are sores, they are dead tissue, they are patches that are along the walls of GI tract. What is the most common culprit that will cause peptic ulcer disease or ulcer in the stomach? It is a bacterial parasite which we called H. pylori. So it is a common MCQ that people ask in the exams, that H. pylori, it is a bacterial parasite. Next, so what is H. pylori? It is a spiral shaped gram-negative organism that attaches to the lining of the stomach. It will release chemicals that will cause inflammation and damage the stomach lining, which will lead to ulcer formation. So when there is H. pylori in the stomach, an immune response is initiated. It will activate immune cells that will damage the neighboring cells in the stomach and small intestine in the process of killing bacteria. So it is a spiral-shaped gram-negative organism that attaches to the lining of the stomach, and it will release chemicals that will cause inflammation and damage the stomach lining, leading to ulcer formation. And pylori elicits an immune response. Activated immune cells will damage the neighboring cells in the stomach and small intestine in the process of killing bacteria. So it is how the whole process happens when there is an H. pylori, which will cause ulcer in the stomach. So there are type of ulcers. The first one we are going to discuss is stress ulcer. It occurs in critically ill patients, those who are bedridden. Serious illness, stress, and trauma will lead to decrease in the protective mucus layer of the stomach and an increase in acid secretion in the stomach. So one of the reasons is that there is an increase in acid secretion. We take medicines which are antacids that will decrease acid secretion. So when you are seriously ill, when there is so much stress and trauma, which will decrease the protective mucus layer of the stomach. How we can prevent this? Patients who are in intensive care settings, they are routinely given medications that will reduce stomach acid to prevent stomach ulcers, because the first reason is that the acid in your stomach, which gets more than normal, so it will lead to ulcer. So we have to reduce that stomach acid, which will prevent the stomach ulcers. Now, non-steroidal inflammatory drugs, for example, ibuprofen and aspirin, they also cause ulcers, and these, because they are acidic drugs, so these will irritate the GI tissue and it will erode. Erode means rupture the tissue of the GI, which is gastrointestinal. So they also inhibit production of prostaglandins. So we have prostaglandins that will protect the stomach lining, and which will inhibit the production of prostaglandins, and it will increase in the irritation of the stomach. So what prostaglandins do, they produce inflammation and pain throughout most of the body. But what they do in the stomach, they protect the lining from acid secretion. So when there is acid secretion, so it will protect the stomach lining. Prolonged use of NSAIDs remove the protective effects of prostaglandins in the stomach and can result in GI ulceration. So there is ibuprofen and there is aspirin, which will cause ulcer because they are acidic drugs, so they will irritate the GI tissue and they will inhibit the production of prostaglandins. In the whole body, prostaglandins produce inflammation and pain, but in the stomach they protect the stomach lining from the acid secretion. When we use NSAIDs prolonged, then they will remove the protective effects of the prostaglandins in the stomach, and which will result in the GI ulceration. When ulceration erodes into a blood vessel, so when these ulcerations which are in the stomach, they will erode, it will go into a blood vessel, a GI bleed can occur. And GI bleed may be asymptomatic for many patients. Patients those who take long-term NSAIDs, aspirin and anticoagulation therapy, they are at high risk of ulcers and life-threatening bleeding. So those patients who are on long-term NSAIDs therapy, such as low-dose aspirin for anticoagulation, they are at higher risk for GI ulceration. So what is the treatment for ulcers? We take antacids, we take proton pump inhibitors and H2 receptor blockers. I will discuss the treatment in my next video. Till then, we have the basic knowledge of ulcers. What are ulcers? What are the type of ulcers? How ulcer happens? What is the main culprit for this ulcer, and what are the medications that are at high risk of ulcers, that are NSAIDs, aspirin, ibuprofen and low dose aspirin, anticoagulation therapies when we take these low dose aspirins, and what are the treatment, antacids, H2 receptor and blockers, which we say antagonists, and proton pump inhibitors. I hope we have clear understanding of the ulcer, type of ulcer, and don't forget to subscribe and like my channel, and stay tuned for further information. Thank you so much.